welcome to this installment of Frank and Mary here in Northborough. This is one of this is the first show that I'm doing with Chris Lindquist, whom I had invited to be my co-host during the winter while my usual co-host was gone. But then came COVID-19, so we are now not in the studio. Obviously, we are virtual. Thanks to the help of Northborough Cable, and we're going to be talking to you about kind of how we've been dealing with it, how the library has been dealing with COVID-19, how my firm has been dealing with it. I want to give you a little bit of advice on how you should be dealing with it from in terms of your documents from that perspective. And then we're gonna we're just doing this show so that you'll have a sense of how this show works. We're hoping to be doing this show weekly now until the COVID-19. I don't want to call it a crisis, the thing, until our lives in COVID-19 have changed. But first of all, Chris, or I just wanted to also say, just as a kind of a disclaimer, Chris and I. We're trying to get you information that we think would be valid for you. Neither of us is a healthcare professional. We're not trying to give you any advice about these things. We're trying to get you information that we think is up to date, but we kind of can't vouch for that ourselves. So anyway, thank you for watching, and Chris, thank you very much for doing all of this. Right? So we were talking beforehand about just kind of telling folks about kind of where things are right now. And so can you just talk about that from your perspective dealing with the library?
Arthur, I was just going to say thank you again for allowing me to talk about, the library and what's happening, in terms of providing remote services. This is kind of the new normal now, right? So we're all dealing with this. Fortunately, we have technology and resources that enable us to, I guess, communicate remotely. And so thank you, and thank Kathy Dalglish and Dana Volk and the Cable Access Station for enabling us to do this. So I really appreciate that. Just to give you an update on what's happening at the library. So we are closed to the public, and we have been closed to the public since March 17th. All non-essential services, all buildings in the town of Northborough have been closed, but staff are in the building, and we're working, behind the scenes. We are not obviously circulating materials. People don't have access to our collections, but fortunately we have really a wide range of electronic resources available that everybody can access via our website. So I just want to give our website up front so that everybody knows, how to get there. And it's www.northboroughlibrary.org. And you go there and you go to our electronic resources page. There is a long list of electronic resources that are available, ebooks, e-videos, e-audio. I mean, a lot of people, are used to using, books on tape or books on CD. So you can also get e-audio, so electronic audio, just like you would if you were, commuting and you were using a CD to listen to a book. You can do that off of our website. All you do need is your library card. So in order to access most of these materials, you're going to be needing your library card. And we are there, by the way. Our staff, our professional librarians, our support staff are working. Some of us are working at the library. Some of us are working at home. And we are there to answer any questions. If we get phone calls, you can still call the library, and our librarians will help you if you need access to the electronic resources. Or you can send us an email. So you just go to our website, our contact information is there, and the librarians and I will be happy to help. Right now, because of what's happening, the town administrator has asked all non-essential services to be available from Monday through Thursday, 8 to 4. And then on Friday, non-essential staff are working from home. So, but we're still going to be responding to emails Monday through Friday, 8 to 4. And if you don't have access to email, you can call our main number, 508-393-5025, and during the 8 to 4 time frame, the librarians and I can assist people. So that's kind of what we're doing. It's kind of the new normal. It's a temporary plan of service in a sense, And obviously, we don't know when this is going to end, but we want to be there to help people, provide information, provide access to the resources that we have during this crisis.
So that's a great service that you're providing, and you're saying that there are real people
Yes,
really there that you can call
absolutely.
during this difficult time. And so even if you are kind of straining with trying to get access over the e process, the electronic process, and you want
Absolutely.
to call somebody at the library just to say, help me figure this out, right?
Absolutely. Yeah.
You're saying
And,
those folks are
we
going to be
know,
there. And I'm
yeah,
sure that our friends at Northborough Cable will be actually putting up that your information, the information regarding, that not only your phone number,
yeah.
but also the e information so that they can try to contact you directly.
Correct. And on that point, so just yesterday we got permission. So we have a subscription to something called Niche Academy, Nische Academy, and they provide tutorials. They're 2 3 minute tutorials that are available on our website how to use these electronic resources or e-resources. And we just got permission from them, even though it's copyrighted material, to use that and to ask Dana and NATV to broadcast that information. So they're allowing us to do that through April, and they could extend it if we need to. So I think there's about half a dozen or so that we're going to be broadcasting. So I think Dana now has access and can provide the links to those, and we'll be broadcasting those videos. And they are basic, again, 2 to 3 minute tutorials how to use Overdrive, for example, or Libby, in order to download, onto your device. Now we know everybody has a different device. I use my iPhone. Some people have a Kindle. Some people use, a laptop or a tablet. And there are various ways to download. But we can help you do that. The librarians have been trained, and we're happy to do that by phone, by email, however we can. So we want people to be using these resources. This is the time, obviously, when people can't access physical books and physical collections. And just go to our website. And if you have questions, we're happy to help answer them and ask, I guess, questions about what your device is so that we can help you more.
And by the way, just I want to say an unrelated but a related thing. I think in the course of an earlier conversation we had, you told me about a service that's been provided by the library where one of your librarians will actually do book readings to kids.
That's exactly right. So Katrina Ireland is our children's librarian, and Katrina has taken it upon herself to be doing story hours, via YouTube, via FaceTime, just again engaging kids in the community, doing her normal story hour in the space where she normally does it in our meeting room, and she's doing that. I think she started doing it last week, and again, that's kind of something that we're obviously having to do during this time period. Just kind of thinking outside the box. How can we continue to engage kids and parents? And Katrina has just stepped up, and I think we've had over 500 views, already. I think she was there yesterday on Wednesday doing another story hour. She's doing something this Friday where there's a book called Hunting the Bear, I believe it's called, and it's a story about kids going around the community and looking in people's windows to find a teddy bear. So this is something that's going to be happening this Friday, and parents and kids will be going around, and obviously you can go outside, and hopefully people will be putting teddy bears in their windows, and it's kind of like a nice game and an outdoor activity. And Katrina's going to read this book, Friday morning, and then parents and kids can go out and hopefully people. And I just want to, encourage people, if you have a teddy bear at home, put it in a window in your house, and kids will be going around the neighborhood looking for those bears.
That is such a great idea. That
Yeah,
just I guess that kind of it really gives you a sense of how people at the local level are just stepping up now.
sure.
I mean, they're understanding these are difficult times. They're trying to not get too stressed out about this, and they're just trying to respond. And I guess the other thing that I would just mention is that for people who are watching us today, I think it would be great and I hope that Dana can just provide the, any links to the station if they could want to be reaching out to us regarding this show. If there are things like that they want to have on this show or on a different show, we'd really like to know about that. Because I know when you were talking about the notion of reading to young people, it struck me that might be a great thing for seniors right now, right?
Absolutely.
To have some, and I know we had talked a little bit about even having a guest come on the show or even having a piece of the show being some kind of reading, right?
Yes.
From, what could be any number of sources, whether it's a poem, whether it is an essay. So I guess we'd be very interested, both Chris, you and I would be really interested if anyone thinks that would be a good idea, thinks it would be a good idea to actually have that on a show. We don't want to be,
Sure.
doing stuff for nothing. But if folks think it's a good idea, then we should be trying this. This notion, I think what we're all going through right now,
Yes,
all of us, and maybe Chris, you're more of a techie. You were probably more into this, but for many I'll say for me and many of my friendly lawyers, my associates at Myrick O'Connell, who have tried to studiously avoid doing all of this video conferencing and all this stuff just because, we got our day jobs and who had time to do this, to figure it out. Now suddenly it can be regarded as a real positive thing, right? That it's forcing people to kind of think about these wonderful resources that we kind of never knew we had, So that's a pretty fortunate thing. So that's great.
I was just saying, Arthur, fortunately, the infrastructure is in place. I mean, most people, hopefully, they have internet access at home and they're able to connect to the internet. I mean, that's number one. I mean, obviously, we need access to the internet in order to do this kind of video conferencing, to access the electronic resources. And then, I think staff, whether, the library, the senior center, recreation, town departments are still operating. Again, obviously, we're close to the public, but we're still there. We're able to respond to emails and phone calls. Town hall, I know the staff is still there working in the building. Right now, just so everyone is aware, we're working on a kind of split shifts. So non-essential services, we're doing A, B at the library. I have a group of librarians that are there at the library today. And then we're going to be alternating kind of Monday, Wednesday, and then Tuesday, Thursday, so that we're not on top of each other, so that we're kind of spread out. We're doing social distancing, obviously, that's the new normal, but we're still going to be providing services as best we can. And questions, concerns, we're an information provider. That's kind of our mission. We obviously want to, help people in this situation. We know people are hunkering down at home and they're looking for things to do. And certainly reading is a great resource, whether it's recreational reading, kids are at home doing remote learning. And we know, hopefully we're going to be able to get Greg Martineau, the superintendent of schools, on one of the shows so that he can talk about what the teachers and administrators are doing in order to help kids, continue to be learning. This is not an extended vacation. I think, as Governor Baker said, you're home, but you're hopefully doing some remote learning, right?
Right. Well, so from my perspective, let me tell you. So I'm at home. I was actually going to go upstairs and put on my suit for this show, and then I just said, "Well, this is stupid. Everybody realizes that everybody's at home, so kill the suit, And I'll say from my own perspective, I know what my wife has been doing, and she had been wanting to learn some Spanish.
Sure.
So now she's learning a lot of Spanish. She's got the whole thing, and she's doing it on the internet, and we're practicing at night because I had known some Spanish from before, and so it's like a great, it is. Let me put it this way: I think what is really hard right now, as true for all seniors, it's especially true if you're in a retirement community or whatever, and you're kind of locked down, is to not succumb to total anxiety. Sure. And just being depressed all the time, and to the extent that you can work your way out of that. And I guess one of the reasons of this show, is to just give folks at the local level the sense that you're not alone. You know, it's not just national and state people, it's
Yes.
just kind of local folks. So let me tell you, as I mentioned, Chris, I also wanted to talk to folks a little bit about a couple of kind of legal, I want to say legal / medical issues that folks want to be should be dealing with right now. You know, so I know we all hope we're not going to get sick. We all hope that, you know, we're going to be in our homes and we're going to be able to kind of, do this in place, and therefore we're going to be fine. But given the fact that all the data indicates, you know, that seniors are much more at risk if you do get sick, right?
Right.
Then I think you also want to be ready for that, right? And I mention that because most seniors that I speak to, if I go to one of my seminars and I say, so who has a healthcare proxy? Everybody raises their hand. Literally, everybody raises their hand. And then I say, so do you know where it is? Oh, well, that's more of a kind of a question. Where is it exactly? It's in some pile. Is it in is it in a file? Is it, kind of, where is it? And so for those people who can't really answer that question right away, like, where is it? You really need to go find it, right? You really need to go find it. And if you've given it to one of your children or someone because they're the person who are named on your healthcare proxy, you should talk to them about that and make sure that that proxy is available, right? To the extent that the proxy is in your doctor's office at this point, that would be the best place for it to be. And I'll tell you that kind of going forward, typically one of the safest places for your healthcare proxy is with your doctor, so that if there's an emergency and you're running a temperature, so you don't know where to find it, and you need to go to the hospital, the hospital can call your doctor, and the doctor can just scan it and send it to them. And now they're going to have that contact, right? Because one of the key pieces of that healthcare proxy is kind of who's your proxy, and typically right on the proxy, that person's phone number or email address is listed, because it doesn't help for the doctor to know that you have a proxy, but not to be able to find the proxy, right? So that piece is really important. The other piece that I think is really important is, once again, I'll ask people, do you have a proxy? Well, yes. So have you actually talked to the person you named in your proxy about how you want to be treated, right? And the answer is typically no, right? But they know, I don't want to be connected to any machines, Well, that may not be the case right now. If you're getting COVID-19, right, and you're having trouble breathing as a result of that, but you're otherwise healthy, right? You may very well be okay with getting connected to a machine until you get better from this, right? So you want to be, but if you're in the hospital and you're incapacitated, and the doctor can't ask you any of that, right? They're going to ask the person who has your proxy, right? And if they don't know, you're really putting that person in a really difficult position, right? Sure. So I guess I would urge people to have this conversation, right? I mean, you're probably talking to your kids now, because if you're older, and once again, I identify with this. Chris, you're a young guy. I just turned 70. I'm in that at-risk category, right?
Yes.
So probably your kids are checking in at this point, and they're saying, Mom, Dad, just check in. How you doing? Blah, blah, blah. Well, if one of them is the proxy, right, you may want to just have this conversation, just because, that's the whole point of having the conversation now, is that if for some reason an emergency arises, now your child knows, right? So it's just really important. So you need to be having that conversation. Also, I should mention to you, lawyers are an essential service. Who knew, right? So when the governor, closed down, said non-essential services go home, we're actually an essential service, right? And while we're not open to the public in general, our lawyers are calling. You can call her up. You can, and we're not on. I mention that just because we as a class are working, right? And so if you've got a question about this stuff and you want to talk to your lawyer, right? Or if you want your lawyer to send the healthcare proxy, which may be in his or her office, to the person you want it to, you can reach them now. I mean, you wouldn't necessarily think your lawyer would be around because we're not a pharmaceutical or a store or something, right? But or if you want to talk to them right now, these are really important times. These are really important times. So I'm just saying in general, you want to be paying attention. That's all. So Chris, I know that what you are tasked with doing after we finish this show is finding our next guest. So we can't tell people right now who our next guest will be. We can tell you that our goal is to be doing this show. We've talked about it once a week.
Yes.
While this COVID-19 is continuing. I know, Chris, you had talked about, if we possibly could, getting the fire chief, who is also the head of the kind of this town's emergency response team, and maybe getting the superintendent of schools to talk about what is going on as far as the teaching of the kids and all of that. Those would be really, really great things, right? And that but people, I'm only here for comic relief. So whoever you want to have on our show, that's what we're going to have on the show. But we'll try to provide these things as informative to people. If people have got a particular request, because it's hard to reach out to people right now. Who would you like to see? Who would you? And I know that in a show that I do in a foreign town called Westborough, which is far away, which we did yesterday, we were talking to the head of the Department of the Health Department.
Sure.
Apparently in Westborough, I don't know what the story is in Northborough. Apparently in Westborough, there were 3 people who have tested positive for COVID-19. So that he was kind of talking about how that system works. If you're the health department and you notify that someone is positive, what they do then, So we may want to talk to somebody. But the point is, we want these to be informative for you folks, right? Because you're sitting around and you're bored, and we just want to be, providing you with valuable information. So, Chris, thank you so much for this. I think this is just great. It's great what the library is doing.
Thank you.
In terms of just helping people, and forcing people to become aware of the virtual world that we live in, right? So thank you, and thank you to Dana, and as you said, to Dana and to Kathy Dalglish. This is. Chris and I talked to these folks about doing this show because one of among other things, I think we're going to come out of this with people much more aware of the importance of community TV, right? And of these stations in terms of providing really important information day to day, but also in emergencies like this.
Absolutely.
So we really want to thank those folks. Chris, thank you for coming on today.
Thank you, Arthur.
Folks, we'll look forward to seeing you in the next episode of Frank and Mary in Northborough, the COVID-19 subsection or whatever. Thank you very much, and hopefully we'll see you next week. Thank you.